Hey DB2 fans, thanks for stopping by again. Today our topic is rotator cuff pathology. Let's get started. The rotator cuff is made up of four muscle groups in the shoulder: supraspinatus, the infraspinatus, the teres minor, and on the front side here, the subscapularis. All of these muscles have to do with range of motion, strength, and stability of your shoulder. But when they're torn or damaged, such is the case with tendinitis, your pain can be significant and your range of motion can be restricted by more than 50%. The problem is, left untreated, those conditions can lead to other pathology of the shoulder, such as frozen shoulder or the development of osteoarthritis in older patients. So if you're suffering from pain, weakness, or an inability to move your shoulder in certain planes of range of motion, it's important to start with a good physical evaluation. It's not always an MRI that can show you what's going on with the shoulder. Oftentimes, a thorough physical examination and even an ultrasound evaluation can provide the answers that are necessary without going to the extreme cost of what an MRI may cost you. Here at DB2, we have that skill. We can give you real-time data to determine whether it's just rotator cuff pathology or if it's something more serious, like a tear in a tendon or significant osteoarthritis in the joint. Either way, you can be confident that we're going to pay attention to what's important to your quality of life. At DB2, we'll create a customized treatment plan just for you that reflects what we've discovered that may be the origin of your shoulder pain. In our experience, we know that steroids play a role. However, overused in chronic shoulder pain can actually lead to a worsening of your pathology. If steroids aren't a clinical indication for you, other treatment options that we engage in on a regular basis here at DB2 include platelet-rich plasma and cellular therapies if necessary. Platelet-rich plasma has been clinically proven to be a reliable alternative to steroids when it comes to shoulder pathology. Platelet-rich plasma is a blood product that's harvested from you yourself. And it's the growth factors and the anti-inflammatory factors that are present in your blood that we use to treat inflammatory conditions of the shoulder. You may ask, why is it not working for me now if it's something that exists in my body today? The reason why is it's difficult for your immune system to direct those regenerative and healing cells into areas that don't have a high degree of blood flow. That's why these tendinous attachments are all represented by white tissue, not red, which has a high degree of blood flow in these areas, but not here, nor inside the actual joint itself. By harvesting from you and directing these types of growth factors into a space that's inflamed, we can make a significant impact on not only your pain, but also your range of motion. In addition, if it's necessary, cellular therapy can also be employed to these same soft tissue regions and as well your shoulder joint, if that's necessary. These cellular and PRP treatments have been proven to be extremely effective alternatives to surgical intervention or chronic steroid injections. At DB2, you're going to get honest answers from day one, as well as effective treatments and therapies. Our all-star team here at DB2 is familiar with treating shoulders on a regular basis, and we understand how important your quality of life is. Whether it's the life of an extreme athlete or someone who simply wants to reach a box of cereal off the top shelf, we know that keeping you independent and functioning to your maximum capability is also what's important to us. Thanks for stopping by. Give us a call today, 636-265-2822.